Hi, good afternoon. My name is Terika Thomas Mills, and today I'll be doing my head to toe assessment video. So I'm going to enter the patient's room, knock, knock, knock. I'm going to close the door behind me for privacy. I'm going to perform my hand hygiene, and then I'm going to put my gloves on. Hi, Miss Morris. Good afternoon. My name is Terry, and I'm going to be your nurse today. Can you verify your name and date of birth?
My name is Kamisha Morris and my date of birth is February 16, 1987.
Okay, so Miss Morris has correctly identified herself using two patients' identifiers. Miss Morris, so today the doctor has ordered a head-to-toe assessment. Is that okay with you?
Yes.
All right, so Miss Morris has consented for the head-to-toe assessment to be done. Miss Morris, can you tell me what date is?
It's a Saturday.
What date is it?
It's March 21st, 2025.
All right, can you tell me the time?
It's 6:20.
Can you tell me where you are?
I'm at the Kings County Hospital.
And can you tell me what brought you here?
I did a surgery a few weeks ago, so I wanted to come in and get an assessment done.
Okay, so Miss Morris appears to be alert and oriented times 4. She doesn't show any signs of distress. She has good posture. Her personal hygiene appears to be normal, and she doesn't seem to be having any respiratory distress, and her hair is nicely combed and groomed. All right, Miss Morris, for this assessment, normally we would take the patient's blood pressure, the patient's vital, but for the sake of this video, her vitals were taken off camera. So her blood pressure is 120/80. Her heart rate is 90 beats per minute. Her respiratory rate is 18 breaths per minute. Her temperature is 98 degrees Fahrenheit, and her oxygen is 97%. All of which are within normal range. So, Miss Morris, are you having any pain?
Yes.
Where exactly in your pain? Is it at the surgical site?
Yes.
All right, so on a scale of 0 to 10, 0 being the worst pain, 0 being no pain, and 10 being the worst, can you tell me what number your pain is at?
I would say it's a 4.
Okay, so all right, I'll let the doctor know, okay?
Okay, thank you.
All right, so for this assessment, Miss Morris, I'm gonna be assessing various areas of your body, and I'm also gonna be touching you also, okay? So be mindful.
Okay.
All right, so for this assessment, I'm gonna start with her face. Okay, so Miss Morris, her face appears to be symmetrical. There's no drooping or no swelling. Can I see your eyes, Miss Morris?
Okay.
Okay, so her conjunctiva is pink and moist, and her sclera is white. Okay, Miss Morris, I'm going to take my light. Okay, so Miss Morris, her eye movement is symmetrical. Her pupils are round and equal, and they're reactive to light and accommodation. All right, so next I'm going to be checking your ears, Miss Morris. Okay, so her ears is her tympanic membrane is intact bilaterally, and her she doesn't have any discharge, there's no bleeding, and there's no excessive wax buildup. So Miss Morris, I'm gonna whisper in your ear, and then you're gonna repeat what I told you.
4. 5.
Okay, so Miss Morris was able to repeat what I said to her correctly. So now I'm gonna be assessing your nose and I'm gonna be palpating your sinuses.
Okay.
Okay, so her nose or nasal structure is symmetrical. Her septum is midline and she doesn't see, there's no swelling or no redness. All right, so Miss Morris, what you're gonna do for me, you're gonna take your left finger, one of your left fingers, you're gonna cover your left nostril, and then you're gonna breathe out through the right. Okay, good. So you're gonna cover your right nostril, and then you're gonna breathe out through the left. Okay, so Miss Morris, her nose is patent based on her alternate breathing. All right, so my next assessment that I'm gonna be doing is her oral assessment, and this assessment consists of her throat and her mouth. All right, Miss Morris, I want you to hold your head back, and then you're gonna open your mouth wide. Ah. All right, so her lips are pink and moist. Her teeth is intact. Her gum is pink and healthy. Her tongue is midline and is moist with no abnormalities. Her tonsils are absent, which is to be expected based on the surgery, and the white patches are noted, and there doesn't seem to be any bleeding. All right, so my next assessment now is going to be her neck. I'm going to assess her neck and her lymph nodes. Okay, so her neck, for her lymph nodes, there's no tenderness or swelling, and her thyroid is midline, no enlargement, and there's no jugular vein distension. And Miss Morris, can you move your head up and down, left and right? Okay, so Miss Morris appears to have full range of motion in her neck. All right, so my next assessment that I'm going to be doing is the respiratory assessment, and I'm going to be assessing her lung sounds. Turn to me. All right, so her lung sounds are clear bilaterally. There's no crackles, no wheezing, or no rhonchi. All right, so can you, Miss Morris, can you just cough for me? All right, so upon observation, her chest expansion is symmetrical. There's no extra accessory muscle being used. There's no breathing, there's no bruising, and there's no tenderness upon palpation. All right, so next I'm going to be doing my cardio assessment. I'm going to be listening to your heart sounds. All right, so her heart sound is normal. S1, S2, there's no murmur and there's no extra heart sound noted. All right, so now I'm going to be assessing her capillary refills in her nails and her fingernails and her toenails. Okay, so her capillary refills, it's normal. It's less than 3 seconds, and it's less than 3 seconds in her fingernails and her toenails. Now I'm going to move on to my pulse assessment. I'm going to be assessing your carotid pulse. Okay, so her tympanic pulse is present bilaterally. Now I'm going to be doing your radial pulse. Okay, so her radial pulse is present and it's equal bilaterally +2. Next I'm gonna move on to my abdominal assessment. I'm gonna be palpating her abdomen. Okay, so there's no distension, no discoloration. She doesn't have any surgical scars or bruising, and there's no palpable masses, and there's no girding or rigidity. And upon auscultation, she has clear bowel sounds in all 4 quadrants. Miss Morris, can you tell me when was your last bowel movement?
A few hours ago.
Okay, that's good. And when was your last menstrual period?
2 weeks ago.
Okay. All right. So I'm gonna move on to the musculoskeletal assessment. All right. So I'm gonna be checking her feet. I'm gonna be checking the skin integra. I'm gonna be checking for edema, any tenderness. Okay, can you push up for me? Push back. Push. Push. Okay, can you hold on? Push for me. Push. Push. Okay, so for the musculoskeletal assessment, Miss Morris, she doesn't have there's no edema present, and she doesn't have any tenderness in her joints, and for her, she has full range of motion in the upper and lower extremities, and there's no redness. All right, so I'm gonna move on to my neurological assessment. Miss Morris, can you stand for me? And I want you to walk towards the camera, take a few steps forward, 1 foot before the other. Okay, you're gonna turn, walk back towards me. All right, you could have a seat. So Miss Morris appears to have a steady gait. She doesn't show any signs of limping or any weakness. Miss Morris, can you take your finger and I want you to touch your nose? Okay. All right, so her cerebral function is intact. It appears to be intact. All right, so for my final assessment, I'm going to be assessing her skin and her nails. Okay, so her skin is moist and dry, and it's warm to the touch. She has no lesions, no abrasion, she has no rashes, and she doesn't have any skin breakdown in any bony prominences, and her skin texture is normal. There's no tenting, and her nail beds are normal, and there's no flushing, and her skin texture, like I said, is normal, and she doesn't have any signs of any clappiness. All right, so this takes me to the end of my assessment. But before I go, Miss Morris, I just want to give you a few little points to note. I want you, if there in case there's any bleeding at the surgical site, ensure that you inform the nurse of this.
Okay.
And in terms of your bowel movement, just in case it looks dark or tarry, if there is any dark or tarry stool, that's something to be concerned about. So you ensure that you inform the nurse about this.
Okay.
And you need to ensure that you stay hydrated. Ensure you're drinking enough water. And some signs of dehydration that you could look out for is skin dryness and if you're making little to no urine at all, that's something to be concerned about, okay?
Okay, thank you.
All right, do you have any questions, any concerns?
No, not today. Thank you.
Okay, all right, so Miss Morris has no questions or concern. So before I go, I'm going to ensure that she's left in a position of comfort. I'm going to ensure that the bed is in a low and locked position. Miss Morris, here's your call bell.
Thank you.
Should in case you need help, don't hesitate to call.
Okay.
And I am going to remove my gloves. I'm going to perform my hand hygiene and then go document my procedure.